Hi guys, and welcome to this video. This video is just going to be a short introduction into the foramina of the skull. Last video we spoke a little bit about the cranial nerves and where they exited from the brain, but now we want to know where they exit through the skull and therefore attach or innervate their respective areas. So, having said that, I've made this small little table on the side of the screen here, and it tells you which cranial nerves are going to be running through their respective hole in the skull. So, starting with number one, the cribriform plate. The cribriform plate is located on the frontal bone of the skull, and it's this plate right here. We said before that cranial nerve number one, the olfactory nerve, has about 15 to 20 nerve fibers that run through and therefore innervate the nasal cavity. And so all of these 15 to 20 little fibers run through all of these little holes on the cribriform plate. So that's number one. So moving on from that, we have the optic canal. Now the optic canal is located on the lesser wing of sphenoid bone, and you can see it very clearly here on either side. Now the optic nerve runs through here, or cranial nerve number two, and it kind of makes sense because you can see how it forms this X shape. And this X shape is very much in line with the shape of the optic chiasm, and therefore where it creates the optic tract and where it continues on. So it makes sense that this X shape here would be the optic canal because the optic nerve would be running through it. So that is number two done. So optic canal, cranial nerve number two. We then have the superior orbital fissure. Now the superior orbital fissure is located on the greater wing of sphenoid, and it's quite difficult to see because it is located a little inferior and underneath to the greater wing, to the lesser wing. And you can see it very clearly right here, this shape. And if I were to turn this around, you would see very clearly that there is a clear passageway through the orbit, and that passageway is again the superior orbital fissure. And the reason it comes through there, and the reason you can see it very clearly through the orbit, is because the cranial nerves that run through it innervate the eye, and more specifically the eye muscles. So, which cranial nerves run through there? Well, cranial nerve number 3, number 4, number 5V1, and number 6. What I mean by 5V1 is I mean the first division of the fifth cranial nerve, which would be the ophthalmic division of the trigeminal. So moving on from that, we have the foramen rotundum, and you can kind of see how we're making this pattern all the way down, going from 1, 2, 3. So if I ask where the foramen rotundum would be, it would make sense that we're located just below it, as we are forming this pattern of moving downwards or posterior from the skull. So foramen rotundum would be this foramen or hole right here. Which cranial nerve runs through this? Well, V2, or the second division of the fifth cranial nerve, so the maxillary division of the trigeminal. Moving down again from that, we have the foramen ovale. Now this one's quite easy to identify, and a lot of my students like this foramen because it's easy, because it's in its name, foramen ovale, ovale just meaning the shape, and it is very clear how this foramen is in fact an oval shape, and hence it gets its name. So what runs through this foramen? V3 of the fifth cranial nerve, so the third division of the trigeminal nerve, which would be their mandibular branch. The mandibular branch runs through the foramen ovale. Moving on down from that, we then have the internal acoustic meatus. Now this one's quite easy as well, because the internal acoustic meatus, well, first of all, it's here, and if I were to show you on the other side as well, it is there. And I say this is easy because one of the cranial nerves that run through there, the vestibular cochlea, kind of makes sense. Well, one, because it's in the name internal acoustic, meaning sound, and vestibular cochlea, we know that is going to be responsible with the ear, and it makes sense that therefore it's going to be located somewhere on the temporal bone, because that is where our ear would be from an external view. So moving towards the inside of the skull, it would make a lot of sense then for the internal acoustic meatus to be in line with the temporal bone, and hence the ear, because the vestibular cochlear nerve would run through there. Even though cranial nerve number 8, the vestibular cochlear, does run through there, there is also another one, and that is 7, which is the facial nerve. And I spoke a little bit about this in my last video when I described the cranial nerves and when they stem from on the brain. Facial nerve and the vestibular cochlear nerve run together from the area of the pons, and therefore they passageway through their respective foramen together as well. So moving on from that, we then have 2 more. Now, jugular foramen is quite an easy one as well, and the reason I say that is because it is quite a large hole. Not this one here, but this one here and here. And this is our jugular foramen. It gets its name because, well, the jugular vein passes through, and therefore it gets its large size as well. But not only that, but also 3 cranial nerves run through there. Which ones? 9, 10, and 11. So glossopharyngeal, the vagus, and the spinal accessory nerves. On the last one, the hypoglossal canal is located actually a little inferior to the clivus bone and a little lateral to the foramen magnum, which is this large hole which passes our spinal cord, is the hypoglossal canal. And you can see it if I just turn it to more of a lateral aspect, and you can see this small hole here, like I said, located inferiorly to the clivus bone on that side, and therefore on that side as well. And which nerve would this pass? Well, it's kind of in the name. The hypoglossal nerve passing through the hypoglossal canal.